Very good. So without any further ado, Dr. Shen will talk about syncope in patients with no structural heart disease. Welcome, Win.
Thank you, Luis, and welcome to Sedona. I'd like to thank Luis, Eric, and Caroline for having me back on the program. And as Luis mentioned, when it's really a practical and update course for cardiology. And well, the first topic is syncope. Although today that we are very much regulated by HIPAA, I won't ask you about who has had a syncope event in the past. But when we did our epidemiologic study that in Rochester, Olmsted County, and we did a survey with a cross-sectional question of whether a person has ever had a syncope in the population between 40 to 50 years old, and the answer was about 26 to 27% positive. And that depends upon the population that, as we know, that especially in the young military groups, that the prevalence could be up to 50% that having had the syncopal event. So it's really very common. And yet I think it is really interesting what Luis is asking me to do today is that, well, syncope in patients without structural heart disease. Well, we think about this particular population, we think, well, it is really that the population with young patients with vasovagal syncope. I have no any financial disclosures, and let's see. So I will continue to talk as we get the mouse to work. And so I thought that I first give you a couple case examples I'd like to get your thoughts about and the relevance to the evaluation. And then I'd like to take you through that a number of relevant areas evaluating patients with syncope. But I really like to highlight, again, thinking about this particular patient population, what tests we really do not want to overdo and what that not to miss. I think that is really the importance of this particular population, because that although infrequent, there are some conditions that when the patient presenting initially with syncope, there may be risk at a cardiac event or a certain cardiac death. And then I will summarize with the take-home message. First is a 24-year-old young person, and she had a syncopal event while that in the supermarket she was waiting to check out, and she had the loss of consciousness. There was some shaking observed by the witnesses, and you will see that